Well, the COVID pandemic took a huge toll on all of us, but was especially challenging for healthcare workers who were on the front lines. Studies show they faced a 3 times greater risk of contracting COVID, and thousands died as a result. Today, Wink News health and medical reporter Amy Osher joins us with the exclusive story of a local doctor who made it back from death's door and is now suiting up to practice again.
David Wilkinson may have said it best. The Naples urologist went from caring for people to being cared for. His COVID battle took life-threatening twists and turns. Now he's doing what most people thought unthinkable, going back to work. In sickness and in health, a vow Karen and David Wilkinson took 29 years ago, never thinking how it would be put to the test.
2021 was not a good year for me.
The Delta variant of COVID, it just kind of came upon Florida, took us all by surprise, and David got deathly ill.
Sickness was everywhere. As a doctor, David put his patients first.
You can't just shut your office down for people who have emergencies. I'm 100% certain I contracted in the office.
The early years of the pandemic were much different than today. COVID was indiscriminate and brutal. These images of David's lungs left little room for hope.
3 weeks after COVID, 80% of my lungs were destroyed.
When he couldn't breathe, the family made a difficult decision, putting David into a medical coma and on a ventilator.
We cried. I mean, the reports at that time, if you recall, were people aren't coming off the ventilator.
The last thing I said was a promise to my wife that I was coming back to her.
There were 4 separate times they called our family to the bedside to say, this is it.
David lingered on death's doorstep for months.
At one point, my carbon dioxide level got to 128, which is not compatible with life.
While David fought to hang on, he had no idea how hard his wife was fighting too.
The only option for him to possibly survive was to get a double lung transplant. And there was only one in the United States that said, you know what, we'll take a risk. We're not sure it's going to work out. And so even placing his lifeless body on the helicopter, I wasn't sure if I would see him alive again.
David was flown to Advent Healthcare in Orlando. To be eligible for new lungs, he had to come out of the coma and walk. It was a long, improbable feat.
I got to the point where I was able to stand, able to walk with a walker on oxygen, and qualified for the transplant.
When donor lungs became available, David underwent 9 hours of surgery and woke up a new person.
When people tell us, like, you received a miracle, I honestly say, you can't even count how many miracles.
Against all odds, David is now putting on his white coat and returning to practice.
Kind of makes me remember why I do what I do.
Doctors told him he's their only COVID lung transplant patient to make a complete recovery.
It's really interesting when you've taken care of people your whole life, but then suddenly you're the person being taken care of.
Recommitting himself to medicine, it's another vow he promised to keep. Amy Osher, Wink News.